Hush vulnerable individuals. Introduction. In psychology, vulnerability refers to a condition in which an individual has a reduced ability to cope with physical, psychological, or social stressors, making them more prone to harm, distress, or mental health problems. Definition of vulnerable individuals.
1.
WHO. Vulnerable individuals are those who are at increased risk of physical, psychological, or social harm due to limited resources, poor health, or reduced coping ability.
2.
American Psychological Association, APA. Vulnerable individuals are persons who have a greater likelihood of experiencing psychological distress or mental health problems because of personal or environmental factors. Characteristics of vulnerable individuals.
1.
Emotional characteristics. Vulnerable individuals often show emotional instability. They may feel anxious, fearful, sad, or hopeless. They usually have low stress tolerance and may become emotionally overwhelmed easily. Frequent feelings of fear, sadness, or anxiety, emotional instability, low tolerance to stress, feelings of helplessness and hopelessness.
2.
Cognitive thinking characteristics. They commonly have negative thinking patterns, poor self-image, and low self-esteem. Decision-making and problem-solving abilities are often reduced, leading to dependence on others. Negative thinking patterns, poor problem-solving ability, difficulty in decision-making, low self-esteem and self-confidence.
3.
Behavioral characteristics. Behaviorally, vulnerable individuals may show social withdrawal, avoidance of responsibilities, or excessive dependence. Some may exhibit maladaptive behaviors such as aggression, risk-taking, or substance use as coping mechanisms. Withdrawal from social interaction, dependence on others, avoidance of responsibilities, risk-taking or maladaptive behaviors.
4.
Social characteristics. They often experience poor social support, difficulty forming relationships, and social isolation. Fear of rejection, stigma, or discrimination is common. Poor social support, difficulty in forming relationships, social isolation, fear of rejection or stigma.
5.
Coping characteristics. Vulnerable individuals usually have ineffective coping skills. They may rely on others for support and frequently use defense mechanisms like denial, withdrawal, or regression. Childlike behaviors.
6.
Psychological health characteristics. They are at higher risk of anxiety, depression, stress-related disorders, and low self-confidence, which further increases their vulnerability. Categories of vulnerable individuals. Vulnerable individuals can be classified into different categories based on age, health status, psychological condition, and social circumstances.
1.
Children. Children are vulnerable due to physical and emotional immaturity and complete dependence on caregivers. They are at risk of neglect, abuse, malnutrition, and developmental problems, which can affect their psychological growth.
2.
Adolescents. Adolescents face emotional instability, identity confusion, peer pressure, and risk-taking behavior. These factors make them vulnerable to stress, substance abuse, anxiety, and depression.
3.
Elderly. The elderly are vulnerable due to aging, chronic illness, loss of independence, and social isolation. Psychological problems such as loneliness, depression, anxiety, and cognitive decline are common.
4.
Women. Women may be vulnerable because of gender discrimination, domestic violence, reproductive health issues, and social pressures. These factors increase the risk of emotional distress and mental health problems.
5.
Persons with mental illness. Individuals with mental illness are vulnerable due to impaired judgment, stigma, and poor coping ability. They may face neglect, discrimination, and difficulty in social functioning.
6.
Persons with physical disabilities. Physical disability may lead to dependence on others, social exclusion, low self-esteem, and psychological stress, increasing vulnerability.
7.
Chronically ill individuals. People with long-term illnesses experience continuous stress, pain, financial burden, and lifestyle changes, making them psychologically vulnerable.
8.
Socioeconomically disadvantaged individuals. Poverty, unemployment, poor housing, and lack of education increase vulnerability by limiting access to healthcare, nutrition, and social support. Factors influencing psychology of vulnerable individuals. Biological factors. Age, children and elderly. Chronic illness or disability. Genetic vulnerability. Psychological factors. Past trauma or abuse. Inadequate coping mechanisms. Personality traits. Social factors. Poverty. Family conflict. Neglect, abuse, or discrimination. Role of nurse in caring for vulnerable individuals. Assessment identifies physical, psychological, and social needs and risk factors. Emotional support provides empathy, reassurance, and active listening to reduce anxiety and stress. Health education educates individuals and families about illness, treatment, and coping strategies. Counseling and referral offers basic counseling and refers to mental health professionals when needed. Advocacy and protection protects patient rights and prevents abuse, neglect, and discrimination. Promotion of independence encourages self-care and decision-making to improve confidence and well-being.